All right, folks, and we are coming up on our last speaker of today, although very excitingly, we have a whole other day planned for you tomorrow. Today we have Nattawipa Ampaiwan here. She is a PhD student from Michigan State University, and she's going to talk to us about the unique welfare challenges that community cats face and how we can go about measuring the welfare of cats in these sorts of environments. Take it away. Oh,
thank you. Hello, everyone. My name is Nattawipa Ampaiwan, or you can call me I here, just like normal I. I'm from Thailand originally, but I'm currently studying at Michigan State University, pursuing my PhD here. And another study about cat again today. Do you know the reason why? Because the cats are taking over the world. Well, this is true because they take over the world with their overpopulations. The cat overpopulation is a report issue in many countries. It's estimated that there are about 800 million cats around the world, and over half live outdoor as a free roaming cat. Within the United States alone, there are about 30 to 40 million cats that are free roaming cat, meaning that they are an unowned cat and roaming around freely. And these outdoor populations include a large number of unspayed and unneutered cats. Several terms are used in this industry. So stray cats refer to pet cats that were lost or abandoned but could be rehomed. Feral cats are cats that were raised and born and raised outdoor, and they're not a good candidate for rehoming because they tend to be fearful or aggressive when interacting with people. And both terms stray and feral are often included under the broader term community cats or free roaming cats. One study defined community cats as unowned free ranging cats that the community take responsibility for and manage in place. So previous study that related to community cats mostly focusing on the impact of the cat overpopulations on human health, the environment, and wildlife, but not much on the cat themselves. Research into the welfare of community cats and how to access it is still very limited. One study we found from New Zealand developed a welfare assessment tool for community cats, but it's mainly focusing on physical health. But as we know that welfare is more than just health. So why is it important to understand community cats' welfare and create the tool that tailored just for them? So community cats are not fully white and not fully owned by someone. They often receive a little policy attention and their welfare conditions vary widely. They can have a really good welfare and can have a suffering environment. And there are no specific tools made just for them. Healthy and well-managed colony can help reduce disease transmission in cat colony to both human and other animals. And also, if we have the welfare data, we can use this as evidence to guide better decisions for both the cat and the communities. So given this gap, my overarching goal for my PhD project is to develop a robust and welfare assessment tool that specifically designed for this unique outdoor living condition for this community cats. However, because there's so limited research on community cat welfare, my first goal of this first project is that we aim to identify the welfare criteria that stakeholders seen as a good or poor welfare in community cats, and we also want to identify the tools and indicators that currently used by feline stakeholders to assess the welfare. For hypotheses, we expect that health of community cat will be the most frequently mentioned. Stakeholders will report a variety of different methods or tools that they use to assess welfare, and role in working with community cats will influence their perceptions or tools that they use to assess welfare. For experimental design, for our study, we use the Delphi method, which is a survey-based approach used to find agreement among experts. We ran 2 rounds of survey in this study. First, we sent out a survey to expert panels. Experts were recruited through listserv from the ASPCA, MDART, or Michigan Department of Agriculture, allied cat allies. We also encouraged snowball sampling so participants could share our study with their colleagues. After collecting responses, we synthesized the responses and create the second survey based on the first response. We then sent the second survey to the same group of people who had completed the first survey. The goal was to understand where experts share the similar views and where their opinion differs. For survey 1, we have 5 open-ended questions where we ask participants to describe 2 criteria that they use to identify good or poor welfare in community cats. Survey 2 was based on responses from the first survey. We developed 45 welfare statements for this Second survey and ask participants to rate each using 5-point Likert scale from very poor welfare, somewhat poor welfare, neutral, somewhat good welfare, and very good welfare. And then we also collect demographic data like roles, age, genders, and location in both surveys. For analysis in survey 1, we use thematic analysis to identify common themes, and we use NVivo to help organize responses. Then we use R for statistic analysis for survey 2, specifically for a linear mixed model with Bonferroni for survey 2, to see the relationship between the roles and their perceptions on each welfare statements. For results, we have 596 participants for survey 1 and 269 participants in survey 2, which is a 45% response rate, which is really good. And then the most common role that shown in this table were volunteer and multiple role, about 25% and 22%. And more respondents were from sub-areas followed by urban and rural. And the survey 2, we first asked whether participants believe stray and feral cats should be accessed with different welfare criteria. This question came from observation in survey 1, where respondents seem to treat them differently. Interestingly, over 70% or 200 participants say that stray and feral have different welfare criteria, where around 68 participants feel that they should be accessed using the same criteria. So we then further analyze the roles that might influence the perceptions of the welfare. We have 4 different roles that we analyze in this study. First is caregiver. If you're not familiar with the caregiver, it's the term that represents people who take care of the cat that's not owned by them, but they provide food, water, or shelter. And then we have shelter staff, veterinarian, and volunteer. Across 45 welfare statements, we found 9 welfare statements statistically significant difference across those four different roles, and ferals have 17 welfare statements. And when we look further with those welfare statements that we found it's statistically differences, we found that stray and feral share common welfare statements. Total of statements 8 statements, and feral have a 9 welfare statement unique and 1 unique to stray cat. And that 1 unique statements for stray is when we ask whether cats are not considered eligible for adoption, even if they are friendly toward humans. So most caregivers feel that is somewhat poor welfare, while veterinarians rate it as a neutral. Shelter staff and volunteer lean toward somewhat poor welfare. However, there's still overlap between those 2 roles. And for feral cat, due to the time today, I won't go through each detail on which roles feel about each welfare statement, but I want to briefly highlight area where role different emerge. So first statement that related to food include caretaker feed the cat less frequently than once a day. Cats must hunt exclusively for their food with no human assistance. Related to safety, cats live in a community that does not want free roaming cat in their areas. Related to sanitary and water, cats live in dirty and unsanitary environments. Cats have access to a consistent water source, but it is often dirty or contaminated. Next is behavior. Cats show aggressive behavior of fight with other cats. Help cat receive vaccination for other called vaccine for at least once in their lifetime. Inbreeding occur in cat colony related to reproductions. And the last statement is female cats have litter when they are younger than 18 months of age and are not fully measured. So again, these statements is show that role actually influence their perceptions in feral cat welfare criteria. And then also again, I won't go into every detail that the statement share between stray and feral. However, we found that first group is related to safety and area condition, where statements go with cat live in an area with busy traffic, a toxic environment, and an area with predator and wildlife present. Related to food, cats often have to compete with other cats and wildlife for food. Cats have access to human food, trash, or dog food. And for management, it's actually a few here. First is unlike house cat, this cat must spend their life living outdoor. Other than being spayed or neutered, cats are left alone. Cats are euthanized due to suffering from an untreatable disease. Cats are euthanized due to suffering from a treatable disease. And cats are friendly, but they are better suited for living outdoors. Again, this X statements, I found that its role influenced the perception for each stray criteria and feral criteria. And then we further analyze the community type, include rural, suburban, and urban, whether they influence the perception, participant perception on cat welfare. So we found that there are 4 welfare statements that show statistical significantly across 3 community types and feral for 3 welfare statements. So both stray and feral did not share any common welfare statement for community type. We found that 3 statements in stray and 2 statements in feral, rural, and urban respondents differ the most. Suburban respondents fell in the middle. Remaining statement from both stray and feral was found that urban respondent has perceptions that differ from both rural and suburban groups. So for limitation in our study, more participants that were in this study were from Michigan, California, and Florida. Even though previous research has shown in this map, the darker area mentioned that there are more shelters or organizations that are related to community cats. Expanding the range of respondent location might provide more in-depth criteria or perspective that based on different environmental conditions. Another limitation is that we have an open-end questions for the first survey, which can lead to the survey drop-off. But despite that, we still have a really strong response rate and high quality input. In conclusions, more participants lack of a written or standardized welfare assessment. Stray and feral were seen as having different welfare criteria. Caregiver roles and community types strongly influence stakeholder attitudes. For future study, I want to develop a valid and reliable tool that can access community cat welfare. And I want to launch a user-friendly community cat welfare tool that can be used by public and any feline stakeholder. So looking forward to my new journey here. I want to thank you, my committee members. I have Dr. Singfor and Dr. Jacob from Michigan State University here with me today. I want to thank you, my static consultant that really put a lot of work in my research, Rina and Michigan State University. This is my contact here. So if you have any resources or just want to talk about community cat, feel free to send me an email. And have a good evening.